Well, good morning, everyone. My name is Segun Oyedokun, and my project is on optimizing next-day ultrasound in the emergency department. Okay, so when patients present to the emergency department and they need ultrasound imaging, a decision needs to be made by the emergency physician, of course in consultation with the radiologist, to determine the best place and the best time to perform this imaging. So each hospital has 4 slots available to bring patients back to the emergency room to have their ultrasound imaging done if it's deemed that that is the best option. There's, however, variation in on how these slots are utilized by the various emergency physicians. And so we did a pilot study last year. This is actually prior to before I applied for the CQIP. And we found that half of next-day ultrasound had relevant results, and a large proportion of patients were actually discharged home with no intervention. So the aim of my project is to develop a clinical pathway to guide emergency physicians in choosing the optimum location and timing of ultrasound imaging, thereby decreasing the number of patients returning by about 50% within 6 months of implementation of the pathway. I would like to add that the pilot project that led to this I just came back from a national conference in Halifax just last week, and the exact same project was done by another team from Halifax. So it kind of confirmed to me that this is an important project, and it was quite encouraging. So as soon as the program took off, let me just start by saying I'm married to someone that likes to improve on things. She's constantly changing stuff. I am very conservative, and I'm just comfortable with status quo as long as it's working. But as soon as I started this program, everywhere I go, I'm looking for changes, opportunities to improve. I go to work, get to my department, I'm looking for what can be made better. I go home, I'm beginning to think like my wife. What can we do differently? So it's really impacted on me very positively. So I see myself as a change agent. So I really want to acknowledge the various members of the team I worked with, especially the CQIP consultants. They really kept me on track. In fact, I got so dependent on them. I've run out of time. And I also would like to acknowledge the various physicians that were on my team, my colleagues, radiologists, and family doctors, and most importantly, the patient family advisor on my team. I had a one-on-one meeting with her. She looks me straight in the eyes, and she says, whatever you do, don't let your patients fall through the cracks. And make sure there's good communication between emergency room and the family doctor so your patients don't suffer. So I really appreciate that advice. So the pathway has been developed. I am hoping it will be adopted by my colleagues, and I'm hoping the various components will be well received by the various other colleagues, family physicians, and radiologists. And I really want to thank the various stakeholders that made this possible. I think that you've really improved me. In summary, change is not easy, but it's necessary, and it is doable. And my project is not quite done. You'll hear more about it at during the poster rounds, and I'm hoping to continue and get it to completion. Thank you very much.